Social prescribing is an intentional effort to connect folks who have been isolated with social resources. At Regent Park Health Center, it has looked like this brilliant program and project that has come on board. It really is filling a gap that I think we've all known is required and necessary for our clients and their enhanced well-being.
One of the things that was missing was just having that ability for folks to come in, meet with the social prescribing staff, like look at what are some other opportunities they might want to be involved in. It's really just meshed really well with all the other services we provide because we do provide very low barrier kind of walk in and see what you need and how we can help you.
The real value of the CTS model and this low barrier social prescription model is that there's all these other things that people get access to because they come to the CTS, whether that's the coffee group, social workers, housing supports, medical supports, dentistry, chiropody.
Most of the population I work with are on the ground floor, which are folks who are homeless or unhoused, who have complex mental health issues, perhaps substance use issues. A lot of these folks face barriers in the healthcare system, so we try to keep that low threshold so people don't have to jump through hoops to get healthcare.
Stephanie is a bomb. She's helped me a lot with my interactions and with people. I've had so many people die around me and I'm like, yeah, so she's brought me out of a shell that I never thought I could ever do.
Connecting people to community programs and advocacy efforts is really important for them, to support them and make sure that they are getting their voices heard and are on the front lines of the fight that affects them the most. Once a month, I take people to the Art Gallery of Ontario. Programs like this have brought a lot of joy and happiness to a lot of the clients who have histories of not so joyous lives living on the street, and now being able to interact with old friends and new friends, it is a joyful experience to see happen for people.
I started this program about 11 years ago. It is an art program for women who are dealing with homelessness, mental illnesses, disabilities, and for women who are very isolated. It's a place where everybody has similar issues or similar situations that they can come in and feel safe and feel like they don't have to worry about talking about their problems or explaining anything. It's a safe place for them to come and just experience something new.
Social prescribing is really that upstream preventative care kind of thinking. So I think there is going to be a broader impact on the health system, on spending, on ER visits and hospitalization, and that data will take time to reveal itself, but anecdotally in the meantime, I'm seeing an improvement and an enhancement in the well-being of my clients who have taken this opportunity.
It just gives them that feeling of, being included, just that has a great impact on people's mental health and well-being.
Interaction is good for everybody, right? And it makes me a lot more confident now. I can actually go out and feel like being me.